right, guys. So here's a lovely patient. She had implants. She didn't like them. She took them out. That's what she's left with. So understand that sometimes you make decisions that you want to change. And so now she wants to put them back in. We're going to take out her scar. We're going to give her better cleavage because the gap was so wide. And if we look here, you will notice that she's got a little bit of thoracic hypoplasia. That means her chest is formed a little differently. So we're going to cut out this massive scar. You see how wide it is? It's 2 thumbs, but we're going to get it right today, okay? We are numbing our patients. And again, what's different about this case is that she's had a breast augmentation and it feels like they left all the scar tissue internally. So we have our work cut out for us, okay? Putting in these sutures here because if you look at this side, it's low. See this? Low. But now that I've done this, you see how now the implant's going to stop right there, okay? At our pocket, we've reconstructed the pocket here and here. We've opened it up here. Her muscle goes to here instead of down here. I can't make new muscle, so we have to live with it from there to there, okay? Okay, all right, guys, we're putting our protective barrier on here, okay? This helps the implant not touch the skin. I'm almost tempted to try to put it in. All right, guys, double bagging. Here we have 470 cc high or extra high, depending on the company. These are extra gummy bear implants. And there we have it. Why did I pick high or extra high? It's because she's really skinny. So we don't want something that's too wide and going to make her look top heavy. Okay. Then halfway, look at our gap. We've closed it down to basically 1 finger. We used the old incision. It's still big, but this is her width. So that's why we used high, because if we did low or moderate, it'd be even wider down here. So I think she looks pretty good. You can tell the difference from one side to the other. Okay. All right, guys. So something interesting is you see muscle right here. You shouldn't see muscle if this implant was above the muscle. So this implant was under, this one was above the muscle. So we're going to have our work cut out for us to try and reconstruct this in a better way. Okay. All right, guys. So you see our pocket, we washed it out. And now when I let it go, it's pretty clear. And that's what we want to see. Okay. Betadine. Good. Make sure the betadine gets everywhere. Helps with issues with capsular contraction. Okay. All right, guys. We're putting our protective barrier. Makes me and the patient feel better that the implant is not touching the skin, okay? All right, guys, so we are double bagging again, always trying to protect the implant from having issues. So we put on our second pair of gloves. Now we have our funnel. Again, these are 470s, which is kind of big, but it's going to fit her frame nicely, okay? There we go. All right, guys, here's a lovely patient. Again, she had a previous breast augmentation removal. She didn't like the way they were. She had a bad scar. She took them out because she thought she was having issues. Now we have a 1 finger gap, which we did good. We leveled off her breast. Nice cleavage fullness, a little bit of side boob, and that's it. We're all done.